because I messed and she called. I need to turn this off. Oh, did it wrong. This is shit. I don't have the phone ringing either. This is it. Okay. All right. So we'll first discuss methamphetamines. Um, in abuse, they're usually taken orally, snorted, smoked, or IV. Um, they're called ice or crystal meth on the street. They're a form of dextroamphetamine. They can also be inserted in the rectum. Uh, the effects are arousal, euphoria, and a sense of increased physical strength and mental capacity. Patients may have hallucinations, um, adverse effects cardiac wise. They can have hypertension, um, chest pain, dysrhythmias, vasculitis. They can even have strokes. They can have vasoconstriction, which can be relieved by alpha adrenergic blockers. Cardiac stimulation can be reduced with a mix of alpha and beta blockers if necessary. Other adverse effects: significant weight loss, because they don't eat, they just do their drugs all the time. You will hear people joke sometimes about a meth diet, which is not funny. Um, I worked a weight loss clinic for a few years on Saturdays, and I would literally have people at times come in and say, um, I'd ask what they had done before to lose weight, and they would say meth. So, which of course disqualified them immediately from getting the diet pills. There's, of course, fetal effects. They get meth mouth, which means from the smoking, their teeth rot out in the front. At the clinic I work at on Skid Row, um, I'm with UCLA. USC has a dental clinic, and they do a lot of work with pulling teeth and giving patients dentures. It's usually those patients that have used meth extensively. Um, for their dependence, tolerance, and withdrawal, the treatment is usually CBT. They need better coping skills, a matrix model, which is a behavioral model. They can have bupropion, Wellbutrin or Zyban, modafinil. Those drugs uh, will help um, mimic some of the um, effects that they got with the meth. Um, any drug that gives you hallucinations or psychosis is dumping out too much dopamine. Amphetamines, the whole reason we give it for ADHD is to increase the dopaminergic and the norepinephrine effects in the brain. So when you give bupropion, it also works on the dopamine and norepinephrine in the brain. So it does help that reward center and then those feelings of alertness. And then modafinil, which is provision, which is a controlled substance, also is a stimulant, and it would also have some of the same effects. Next, there's marijuana, cannabis, which marijuana and hashish are derivatives from the hemp plant. Common names: grass, weed, pot, Mary Jane. There's many names for it on the street. Um, it's the most commonly used, but now, of course, it is legal in many states, but it is not legal federally. The psychoactive substance within marijuana is the THC. Um, the non-psychoactive is the CBD. So the CBD, if you notice, have been started to be separated out with medicinal purposes for seizure disorder and other neuromuscular um, uh, disorders. How is it taken? 60% is absorbed when it's smoked. It begins within minutes and peaks in about 30 minutes. And then with the oral, it's inactivated with the first pass. And of course, orally, it's given to cancer patients as for the nausea from the chemo. It increases the production of prostaglandin E, so there are behaviors. You can get some euphoria, sedation. There can be hallucinations. Paranoia is not uncommon. Some anxiety. I've had patients that have come in that are paranoid, not like the schizophrenic paranoia, but um, they may think one girl thought that she was always getting ready to pee on herself. One was convinced that her boyfriend um, was I can't remember. He was doing something really funky, but he kept uh, you know reassuring her, and she was just constantly thinking he was up to something. The therapeutic uses, like I said, you have it as an antiemetic for the cancer patients, an appetite stimulant for the same group, and it can be used for some neuropathic pain. Um, Effects of marijuana are different at different doses and with long-term use. Um, for cardiovascular, it's dose-related and how it affects the heart rate. And respiratory, with acute use, there's bronchodilation. With chronic use, there's airway constriction, just like there is with smoking tobacco. Therapeutic uses for, again, you have the approved uses for the cannabinoids. You have unapproved, the illegal use. There's ongoing medical research, especially for the CBD oil. I have many patients at my practice that are using the CBD for their anxiety and or for pain, and feel that it's very helpful. Um, the legal status we've talked about is where it's legal in many states, but federally it's not legal. And then we have the problem with the synthetic marijuana, which is called spice. That is a very dangerous substance. It does not cause the kind of laid back reactions you get with um, plant-based marijuana. The synthetic that is manufactured in a lab has many different ingredients. No two labs probably use the same thing, because when a lab gets shut down, they just move and reconfigure what they're giving out. We've had a lot of major psychosis with it in the LA area, with of individuals going on rampages and stabbing others, um, and it's a very dangerous synthetic product, in my opinion. How do we compare it with alcohol? Aggressive behavior is rare with marijuana use, except for the synthetic. Definitely with synthetic. Less loss of judgment with marijuana. Again, not true with the synthetic. You do get the increased appetite, so you have fewer problems with the nutritional deficiencies, because people get the munchies. Marijuana produces increased toxic psychosis, dissociative phenomena, paranoia, more so than alcohol, and that is definitely true. If there's going to be any of those, it would be more true with marijuana. Then we have our psychedelics, which is our LSD. It acts on the brain's serotonin receptors, so it's usually taken orally, smoked, or IV. It alters the following: thinking, feelings, perception, and relationship to the environment. Salva causes dreamlike state of unreality. The mescaline from the peyote cactus You have the psilocin, and then you have all of these forms are different forms of it that are made in the chemical labs um, that all cause the same issues with the hallucinations and the separation, the disassociation. Then you have the dissociative drugs, PCP, ketamine. Original use was for surgical anesthesia. Recreational use, you distort sight and sound and produce dissociation. It acts in the cerebral cortex and the limbic systems. PCP is easily synthesized and manufactured by amateurs. Routes are oral, intranasal, IV, and smoking. And then you have ketamine. One thing that ketamine is being studied for um, recognized psychiatric issues, um, but of course nothing has been approved. So we're still waiting to see what will happen with ketamine use. Then you have dextromethorphan. It's an over-the-counter OTC cough suppressant. You use a low dose for antitussive. There are no psychological effects. At doses 5 to 10 times higher, it produces euphoria, disorientation, paranoia, altered sense of time, and hallucinations. It's also used in a combination of cold products and is highly abused by adolescents and teenagers um, because that's like Robitussin DM, because you can get it in regular cough medicine that you do not have to have um, be a certain age to use. So you have to be careful with the abuse of the cough medicines now. In some combinations, you do have to be 18 and you do have to show ID. Okay. So for the MDMA or ecstasy, they are a complex drug with stimulant and psychedelic properties. Um, they're usually made from a methamphetamine and mescaline, which is a hallucinogen. At low doses, it's like LSD. At higher doses, it's like amphetamine. It promotes release of the neurotransmitters, which would be dopamine and norepinephrine. Um, it's usually taken orally. It can be snorted, injected, or rectal suppository. Adverse effects can injure the serotonergic neurons, can stimulate the heart, and dangerously raise body temperature. And that is usually one of the biggest problems when they're used at these raves. Teenagers like to take it at raves, and then it's already a hot environment with the overcrowding, and then they take the ecstasy, and many of them are passing out, and they may even die from the overheating of the body at those events. Inhalants, um, of course, the administration is by inhalation. It can be anesthetics, it can be volatile nitrites or organic solvents. So it's not uncommon. That's why you go to Home Depot and the paints are locked up, because especially the kids will buy spray paint. They'll use whiteout. They'll use the dust off to clean the computer screens. Um, we've had them uh, disconnect air conditioning systems in the backyard and inhale the antifreeze, um, all to get an altered state of being. Because you sometimes you wonder, why would you do that? It's commonly called huffing, um, especially at the schools. Kids will bring the whiteout or the dust off or whatever, or sometimes those markers. They will put it inside of a sock, have the sock in their pocket, and they will, throughout the day take the sock out and huff from the sock the solvent that they have put inside or dissolved inside of that sock. Anabolic steroids or androgens are taken to enhance athletic performance. They increase muscle mass and strength. Massive doses have high risk of adverse effects, and they are classified as a Schedule 3. So they can be very dangerous drugs. They are often taken, obtained, at health clubs, gyms where people go. Many of the trainers or people that work there will sell them to the clients to enhance their performance, and individuals tend to keep taking more and more because they get almost they hooked on the working out and what they're doing to their bodies, but then they start to have personality changes, and um, they can have liver failure and some very serious consequences with anabolic steroids. So the first question is patients admitted for treatment of cocaine addiction. What is the most appropriate thing to do? And the answer is C, provide individual and group psychotherapy with a focus on drug counseling. You wouldn't give them marijuana. The Narcan does not work for cocaine. It's for the opioids. And the methadone would also be for opioids. Question 2, you care for a patient who has used marijuana daily for 7 years. What are some of the manifestations of excessive marijuana use? And the answer is B, a disheveled appearance, lack of interest, and a flat affect. Question 3, patient is admitted to the emergency room with a psychotic behavior with an overdose of PCP. What would be most appropriate? And the answer would be to place the patient in a quiet room with dim lighting. Because the overdose is best managed with isolation from external stimuli. In question 4, which of the following is most commonly abused opioid by healthcare professionals? And that was number A, Demerol. Because since it doesn't affect it doesn't affect smooth muscle. There's really not a lot of outside signs. You'll find individuals that will work while they're taking this and be able to function to a certain extent. And that is it for today. Thank you. Psychotic state, sympathomimetic actions. I have definitely seen psychotic states with the patients, and unfortunately, if their meth use is for a long period of time, for years, unfortunately, they continue with the hallucinations. Not as severe as they had when they were using, but many times they still have residual hallucinations and psychosis. This is a PowerPoint presentation on drug abuse, part 2.